Hello, thank you for coming this evening. I'm George Pitts, Chair of the Photography Program in the School of Art, Media, and Technology at Parsons, the New School for Design. Aperture and the New School are pleased to present tonight's panel discussion about photojournalism on AIDS. I just want to briefly thank some of the following people instrumental in what is the final panel discussion here at Tishman. This program is part of the Confounding Expectations 8 Photography and Context program, presented by the Aperture Foundation in collaboration with the Photography Department of Parsons, the New School for Design, and the Viralis Center for Art and Politics at the New School, with generous support from the Kettering Family Foundation and the Henry Nass Foundation. This program is made possible in part by public funds from the New York State Council on the Arts and the New York City Department of Cultural Affairs. Tonight's panel discussion about photojournalism on AIDS coincides with the recent release of the book Access to Life, an Aperture, Magnum Photos, and the Global Fund to Fight AIDS, Tuberculosis, and Malaria. In the book, Access to Life, 8 of the world's leading photojournalists, all members of Magnum Photos, follow 30 individuals in 9 countries before they undergo anti-retroviral treatment, and 4 months after the treatment, with the intention of documenting the transformative effect the procedure has on their bodies, their lives, and the lives of their families. While we are able to bear witness to the faces, voices, and stories of those whose lives are saved by being granted access to modern medicine, we are also confronted with the stories of those for whom treatment came too late, reminding us just how difficult the struggle to provide AIDS treatment truly is. The New School, Aperture, and Magnum bring together a diverse group of individuals to speak on behalf of this project and others for discussion on photojournalism and AIDS. Now I'd like to introduce Cristina Caputo of the Aperture Foundation.
Thank you, George. Good evening. My name is Cristina Caputo from the Aperture Foundation. Thank you so much for joining us this evening. Located in Chelsea, Aperture is a world-renowned publisher and exhibition space dedicated to promoting photography in all its forms. A nonprofit foundation, Aperture's programs include artist lectures, panel discussions, limited edition photographs, traveling exhibitions that show at major museums and arts institutions in the U.S. and internationally. Please visit aperture.org to find out about more upcoming events. Please note that Aperture Magazine will be offered this evening at a student discounted rate for $25 outside the auditorium on your way out. I'd like to especially thank all the panelists and the moderator, Fred Ritchin, for joining us this evening, and the New School for another incredible season of events, particularly Arthur O., Astrid Charles, Pamela Tillis, Karen Cooney, and George Pitts, and especially Magnum for this evening. Shoka Javadiangi, Danielle Jackson, and Mark Lubell. Fred Ritchin, who will be moderating this evening, is the Associate Chair of the Photography Department of Imaging in New York University's Tisch School of the Arts. Gilles Peress, Magnum photographer, will be speaking this evening. Photojournalist Kristen Ashburn, Mary Anne Golon, former picture editor of Time magazine and the guest curator of Look 3, the Festival of the Photograph, June 11th through 13th in Charlottesville, Virginia. And Mark Lubell, who will be speaking first, is the bureau chief for Magnum Photographs in New York. Please join me in welcoming Mark, and thank you everybody again for coming this evening.
Thank you, Kristen. Success. Thank you all very much for coming out tonight. My name is Mark Lubell. I'm the director of Magnum Photos. I'm going to quickly show you a few samples of some of the work that 8 of our photographers shot during this project. As you were just informed, we sent 8 photographers to 9 different countries throughout the world to cover AIDS and AIDS treatment. The first images that you're seeing now are from Jonas Bendixen. Maybe I should stop this because I'm sorry. Spacebar. Got it? Ooh, sorry. This first subject is quite interesting because Jonas was looking at the transformative effects that antiretroviral treatment had for each subject. I don't know if I can go back, but well, anyway, you really see a tremendous difference in each patient. And not only did Jonas photograph before, the photographers went to each country in November, and then they returned 17 weeks later, usually 4 months after, to see if how the patients were doing and what the effects were. What Jonas did, not only did he photograph each patient, but he also provided each patient with a Polaroid camera. And each day, the patient would take pictures, and you're going to see some of that at the end of this presentation. You'll see the actual effect, and it's quite extraordinary. In fact, when Jonas went back to see this patient, this was what he saw. And he didn't even recognize his patient. He thought this was the sister. You will also see through this work that usually the beginning series of imagery is always indoors or inside, or people are on beds. And usually when the photographers come back the second time around, you see them outside with their family and engaging in their environment and participating in the world, basically. The second photographer that we're showing you is Jim Goldberg. Again, from a photography standpoint, you're seeing a completely different style and completely different technique. Jim used 3.5 millimeter large format, digital, Polaroid, black and white, video, any kind of medium that he could get his hands on, he basically used to try to tell the stories of each of his patients. I'm not going to tell you each story, but hopefully you'll buy the book and you'll read about each one. But I think what you're seeing is that each photographer was trying to not only understand the patient, but understand the environment and understand the conditions around the environment. This is Paolo Pellegrin. He went to Mali. This first story is a very sad story, and what you're seeing is actually the mother of this patient. And what each photographer tried to do was more than just photograph each person, but understand the environment, understand the history, understand the loss that an individual would have if they're no longer around. And you'll see in some of the documenting that the photographers actually took pictures of photographs so that you could understand who these people were. I should just quickly point out that Global Fund was founded in 2002. Within that time, 3.5 million lives have been saved. And when you look at these stories, not all of the patients survive. In fact, it really is an 80-20% basis, so that 80% of the people that start on this treatment actually will recover, but 20% pass on. But when you think of the numbers of patients that have been saved, it's quite amazing, and the impact that they have in their communities. This is a story, obviously, of a young child, and Paolo Pellegrin said that he broke all the rules. He actually ended up adopting this child. He sends support each year. The stories were so amazing. There's a child that wanted to get on a tricycle, and you see in the beginning he couldn't even stand. He was had scars all over his body, and this is when Paolo came back, and you see him on a tricycle, and now he is active and riding around and playing with his brothers. Peru, Eli Reed went to Peru. In each country, the set of circumstances around the patients was quite different. In Peru, the stigma and ignorance of AIDS is quite pervasive, and most people that actually are too nervous to even go in and get a test to see if they have AIDS, and if they do, they definitely don't tell anybody. So this was a story of actually a chef that found out, and you can see, I don't know if you saw in some of the imagery, you really see a dramatic before and after in that patient. I think it's 30 to 40 pounds that each person gains during this process. Alex Maioli went to Russia. His technique from a photography standpoint was, again, to sort of understand the subjects in an in-depth way. So he spent time with each family. He looked at old photographs. He photographed the environments. Again, it was the environment, I think, in Russia that really told the story. And in Russia, patients contracted HIV more through drug use, needles, dirty needles. And unfortunately, in these two stories, both of these patients did not survive. But what the photographer is trying to do is show the life what the life was like, and what the life is like when they're no longer here. Alex, in his approach, shot Russia in black and white, so you could understand the environment and the feeling of Russia. And I think in these images, you get the feeling of each country, which is unique to the situation. So the black and white he shot was actually of the environment, and color was of the patients. This is one woman who was on treatment, was quite depressed, thought about suicide. She has a child. She thought her life was over when she contracted it, and then was on treatment and did obviously survived. Vietnam, Steve McCurry went to Vietnam. I think what's interesting when you're looking at the collective of this project is to see how diverse the people are, to see how diverse the situations in which they are contracting HIV, and the environment in which they are taken care of. In Vietnam, it's very family-oriented, and you'll see all of the imagery. Each patient is usually supported very much by the family. It's all part of a unit, so you can understand when someone loses their life, how devastating it actually is to the families that are involved. Sorry, I'm just going to move to the next. And I'm going to get to the next one. Sorry. So this is a sequence of someone who did not make it. In the next series, this is a gentleman that when Steve got there had just learned that he had contracted it. And you can see here is the sort of the family environment. You can see the patient is not active, lying in bed. Most of our photographers sort of found this. And then you can see when Steve came back, now the patient is engaged with his family. Usually most of the imagery that when the photographers came back you saw an active person that had a wife or family or active in their environment, which was dramatically different. Just very quickly, this is Gilles Peress, who will come up, but you'll see this is some of his work that was shown at the Corcoran Gallery. This whole exhibit so far has gone to the Corcoran Gallery in Washington, D.C. There was a presentation of this work in Paris for World AIDS Day. It is currently in Madrid. It is then going to go to Oslo, and then Rome, and then maybe some other places. Oh, I should just stop here quickly so you can see this. Sorry, I don't have a more visual, but Jonas Bendixen, this was his presentation. I think it's interesting that each photographer, when they went off and shot this work, they were thinking about the ways in which this work would be seen and the way people would engage in this work. So not only did the photographers shoot still photography, they also did video, they also did sound recordings, and they thought about concepts before they went out of how they wanted to sort of understand this. And obviously, when they were in the field, it might have altered based off what they saw. But this is Jonas's example where you saw sort of a before series of imagery, and then it linked with those Polaroids that I mentioned before to the when he returned and what the patients looked like. And when you see these Polaroids, you really see a dramatic difference from the beginning to the end. As I said, well, I'll just quickly stop. Each photographer in their presentation of this material in the exhibition, and I think you'll see it in the book, and I think you'll see it on the website, and you'll see it in the multimedia pieces that were created. This is Jim Goldberg's work. He had in the exhibition actual videos of each subject looking out at you. So as you walked by and as you engaged in the exhibition, you actually saw, and all of these images were hung at eye level. So you're actually engaging with another person. So it's not just a statistic, it's not just a number. These are people that could be in the same room with you, and that's what the photographer tried to demonstrate with his work. Okay, there's several more people that are going to speak, so, this is Larry Tao. He brought back artifacts. Larry Tao, his approach is to try to show you, as all the photographers have tried to show you, sort of a 360 degrees, so he wants to show you the environment as well as the subject matter. I should just quickly say that I feel that the photographers that worked on this project did a tremendous job, but as I have said before, whenever I talk about this work, the real heroes in this entire project was the actual individuals, the individuals that opened their lives up to our photographers and allowed such a sensitive and such a vulnerable situation for the greater good. And really, we're so thankful that they allowed this. And hopefully, with a project like this, it brings a greater awareness, and the amazing work that Global Fund is doing will continue to be supported. Okay, so now I'm going to get off and I'm going to welcome Gilles Peress. Thank you.
Good evening. Anybody who knows me knows how much I hate this kind of performance, lectures, speaking, words, and this for a variety of reasons. The first one is that I am a photographer, and what I do has to deals with the space between reality and words in many ways. So as a photographer, I'm fairly autistic, and I shy away from labels. The second reason is that there is a gap in many ways between here and there.
between us here in our lives and the patients that Mark so rightfully mentioned. Because in the end, Mark is right. It's very much about the patients. So let me tell you a few things about myself, and then I will show you one of the online pieces, one of the audiovisuals that we put online, and then we'll proceed from there. So besides being associated with Magnum Photos for something like 35 years, I also teach. I'm a senior research fellow at UC Berkeley, and I teach at Bard in the Human Rights Department in photography. I was extremely reluctant to go back to Rwanda. I had been in Rwanda during the genocide, and it's one of those experiences that really stays with you. When Mark asked me to be part of this project, he convinced me with a very, very strong argument, which is that it was not a project like other projects in human rights or in the humanitarian field, where you only document victims at the most tragic moment of their life. It's a project where actually there is hope, which is that what the Global Fund does in all its effort, and all the participants to the Global Fund's efforts, proves that we can make a difference. That with donations, some of them very large and some of them smaller, we can provide a better future. So for once, this was a story where there was a positive outcome. I've been involved for many years with human rights issues, and like many of my colleagues at Magnum, we have been of service. But I felt it was all the more exciting to be of service to a project that created a path for action where we could actually improve things. So that's enough words. So I'll put on this. And I'll do Control F as Shoka recommended, but I did Control G, of course. Am I buying something? No. Apple F.
yewe mama wanjye ni umututsi papa yari umuhutu nawe nyina mbese bo nta batutsi bundi wese na nyina ariko jewe mama wanjye ni umututsi papa ni umuhutu nitwa Rurangwa Eliel Karabona, aba naravutse muri 1961, abafite imyaka 46, nkaba narashatse mfite umugore n'abana 4, nkaba naranduye. Nyine uburyo akuriye nyine umuntu yateruraga abantu n'iki bakomeretse cyangwa se mu kubonana nta muntu atakoresha agakingirizo, ntabwo namenya neza ahantu umuntu yaba ari hano. Ni hariya mu karitsiye nyine aho twari dutuye, ese interahamwe zicaga abantu cyane, mbese bikomeye, ariko inkotanyi ziri hafi, ariko nta cyizere cyazo tutanazibona. Noneho rero bituma duhunga kubera ko abantu bagendaga baduhigaga. Kubera nyine ibintu nanyuzemo ntabwo byigize kuba namenya ko nanduye, ntabwo byigize bintera ubwoba cyane, nabifashe nkaho hari ibintu bishobora kubaho kubera n'ubuzima nagiye nyuramo, ntabwo byigize bintera ubwoba cyane mu mpangayikishije.
Ntabwo byandakaje. François amaze kumusuzuma. Yego. Nyine numvaga ngiye nshaka kugira ngo menye icyo arwaye. Maze kukimenya numvishe nta kibazo. Ubundi namubajije nti se ubone ko twajyaga dukundana niga muri 4e secondaire, sibyo? Nkumva nta kibazo, uri umusiribateri nanjye kandi nari umwana muto. Cyo gihe nari mvuye mu wa 8, numva ko nari muto.
Nyine ikintu cy'ubwoba cyo nticyabura, saa kiraza, ushaka gutekereza uti igihe ninamuka mpfuye abana banjye bazabaho nabi, noneho bikaba wagira ubwoba ariko ukihangana, ukaba uteze umuryango wanjye uzabaho gute, ariko icyo kintu cy'ubwoba cyaje ukagerageza nyine kwihangana kuko nta kundi kuntu ubona wabigenza. Ngitangira kuyinywa ntabwo nari nzi ko yanyiza, nanjye uruzo wamenya ko yagukiza ite kandi utari wayinywa nyine ntabwo wayimenya. Ubwo nyine nyuma niho namenye ko imiti ifite akamaro bitewe n'uko nari natangiye kuyinywa. Mbese ugeranije n'icyagiye nari ndwaye, ubu ngubu iyo ntwaye moto ntabwo ari nka cyagiye nari ndwaye. Cyagiye nari ndwaye nta ntege nari mfite, ubu ngubu mfite intege, ku zuba ntabwo nabashaga gukora, nimugoroba ntabwo nabashaga gukora bitewe n'uko byabaga bindya kubera imbeho ntitume nkora.
Njyewe nitwa Mbabazi Marisaline, abafite imyaka 30, ndi umupfakazi, ntabwo navuga ngo ndi umudamu cyangwa ngo ndi. Nanjye nabyirukiye mu bana benshi, ariko ninjye wanyuma, ninjye wari uwanyuma. Intambara itaraba nabonaga twese mu rugo dusabana, nta muntu wavuga ngo uriya ndamwanga cyangwa ibiki, ukabona mwese mushyize hamwe. ariko aho intambara irangiriye uwo dukundana cyane ni Jean. Umugabo wanjye yari umusambanyi, yari umusinzi, byose nabonaga rero bimbangamiye kuri njyewe, ubwo rero bituma tudashobora kubana njyewe. Nkimara kubona igisubizo yuko nanduye, ubwo nahise ntekereza umugabo wanjye, ndavuga nti buriya nawe yaranduye kubera yari akiri mutoya, n'ubu ngubu niyo yamwishe, n'ubu ngubu nawe aba agihari, ko natekereje.
ngenda ngira mbana Jean Marie nawe mu buryo ndamurushyaga njya kwa muganga se mbere nkigera hariya ku bitaro, n'ubundi numvaga ari nkaho nsigaje iminota mike kabisa, numva nagiye, wumva uri kugenda biza gake gake ukire usubira mu muhanda, nta n'uzamenya ahubwo ko ari wowe, mva njye bidashoboka, none byarashobotse. Ngera bakambwira ati Marceline, ati turabona uri aha rwose nta kibazo. Ngiye hari ahantu bashyinguye bakuru banjye, mba numva mbibutse, n'ubundi numva binteye agahinda, ariko nageraho bikaza kumvamo, n'ubundi ntabwo nkunze kuhajya cyane. Njyewe iyo ndebye nanjye arishaba nagize kuba nararwaye, nkarwara imiti yarabonetse, itaza kuboneka nanjye ubu ngubu mba narapfuye. Nabyo rero nabyo ni byiza kuba imiti yarabonetse, kuvuga ngo Imana yari ifiteho umugambi, iravuga ati nubwo urwaye ariko hari imiti.
Nitwa Gilles Goreti, mfite imyaka 43, ndi mama wa Chantal. Chantal namaze kumenya ko yanduye ari wo mwana w'umukobwa mfite, noneho nsubira urudubi, ndongera ndushaho nanone ubwa kabiri, ndongera amahamuka mu bwa kabiri, ndavuga ndayiwe ni n'agakobwa kanjye nari mbyaye kararwaye koko. Ndababara cyane, mbwira Imana, ntariko Mana ntiwazambabariye ntukazana umuti aho gukiza n'uyu mwana ngiye ukandeka. Icyo gihe mfite izo nka 18, nari mfite n'ibindi bikorwa byinshi nakoraga by'ubucuruzi. Naracuruzaga bikongera za nka, nkahingisha mu mirima, imyaka ikera nkagurisha,
mfite amafaranga yo nkura hirya no hino kuko najyaga no mu masoko nkanacuruza nkabona amafaranga nkongerera za nka zikagwira amafaranga akaboneka turaho tumeze neza nta kibazo nubwo umugabo yari yaramugaye iby'umugabo nari narabivuyeho nikorera nk'umuntu ufite imbaraga ubu ngubu inka ntazo nsigaranye izo nka zashizeho ubu naje gutangira kunywa abagitirimu inka zari zisigaye ntangira kuzigurisha ndavuga reka nigisha abana muri izi nka nkeya zisigaye inka ndazigurisha ngenda nigisha abana 3. nyuma y'iyo myaka 5 narihebye ubwo ngubwo naje kugenda nkomeza ubuzima bw'iyo miti ngenda nigarura icyizere yuko nzabaho nkamara ukwezi nkamara amezi 2 bukeye mara umwaka mara n'uwa 2 mara n'uwa 3 ndumva ngeze mu mwaka wa 4 ubu ngubu ubundi umva mfite icyizere cy'uko n'imyaka hafi 20 nayimara mbese ubu ndumva narigaruriye icyizere cy'abantu bazima
muri iyi minsi imiti yangiriye akamaro kanini ntabwo nyicika intege cyane hambere ntarayinywa nindangiza kwiga ndashaka kuzaba umuganga impamvu no kugira ngo njye mvura abantu
maze igihe mbwira abantu ko Imana ikiza urubwa maze igihe mbabwira yuko ikuraho igisuzuguriro maze igihe mbivuga yuko Imana iruhura abarushye bakaruhuka bakaba mu mahoro maze igihe mbwira abantu ko Imana ikiza urubwa maze igihe mbabwira yuko ikuraho igisuzuguriro maze igihe mbivuga yuko Imana iruhura abarushye bakaruhuka bakaba mu mahoro
nitwa Ukizabikira Riva mfite imyaka 20 mbere yuko ngera mu bitaro by'i Rwamagana nabwo nari ndiho nabi nari narabyimbagatanye mu maso umubiri wose ahantu hose naratumbye ubwo ngubwo rero abantu nibo bankuye ku muhanda banjyanayo
yarirahiriye Imana yarirahiriye Imana yarirahiriye
mama yapfuye mu ntambara yapfuye mbese yishwe n'amasasu intambara irangiye ariko papa we ntago muzi ntago nigeze mumenya mama wanjye amaze kwitaba Imana ubwo ngubwo nibwo niho nahereyeho nkajya ngenda mba mu baturage nkakorera ibyo kurya ubundi nkitekera bigeze aho ngaho rero ibyo ngibyo mbivamo njya kuba igitaramo naragendaga nkareba nk'inzu itagira nk'abantu nkayisaba noneho nkayicumbikamo nkajya nyibamo ubwo ngubwo nkagenda nshaka ibyo kurya uburyo nanduyemo agakoko ka sida ni uko nabaga ahantu igitarama nkorera umugabo w'umusirikare yari afite umugore ubwo ngubwo rero bukeye aza guhengera umugore we agiye ku ishuri ubwo ngubwo aramfata turabonana afata ku ngufu nyuma yabwo n'ubundi twarongeye turabonana ntekereza ko aribwo naba naranduyemo
yavuze yuko icyubahiro cyayo itazagiha undi kandi nizemera ku izina
numvaga nawe nzabona vuba kubera yuko numvaga ko nubwo wenda naba nkeneye no kumushaka ntawe nabona kubera ukuntu nari meze
yateguye farashi yo guhekwaho irategeka bamutambagizaho bamusebereje kandi uwamutambagije niwe wari kumumanika Morodoka yari yamanikiwe igiti cyo kubambwaho.
It's a real honor to be here tonight, so I thank you for asking me to be part of the panel. I wrote a few things down because I tend to forget while I'm speaking, so bear with me. I first began documenting the effects of HIV/AIDS in Africa in December 2000. I was drawn to the issue after reading a series that Mark Scoof from the Village Voice did. It was the statistics that I read in his articles that moved me to this issue. On November 2nd, 1999, in an article I read, he says, "Only 17 years have passed since AIDS was first found in Africa on the shores of Lake Victoria. Yet according to the Joint United Nations Program on HIV/AIDS, the virus has already killed more than 11 million people in sub-Saharan Africa. More than 22 million others are infected." So it was these statistics that drew me to the crisis, and at that time, ARV drugs were non-existent in Africa. It was clear to me that because of a lack of resources, millions of people were going to die, and they have. Unlike here in the States, where you would see ads that would show healthy men and women climbing mountains on their ARV treatment, in Africa, people looked at their HIV status as a death sentence, and in many cases, it was. Without treatment, their bodies would soon succumb to the effects of HIV. So 7 years after starting this project, today, it is said that more than 25 million people have died of AIDS since 1981, and that there are over 22 million people living with the virus. There are 12 million orphans in Africa as well. What is clear then and what is clear now is that lives are at stake. Only a quarter of those who are infected actually get treatment. This is Wendy. She's one of the first people that I met in Zimbabwe. Her body was completely covered with sores. It was as if her flesh was literally rotting away. This is her son, Valentine. Of course, both are HIV positive and both died of AIDS. He was so frail that you could literally see every bone in his body, and when he coughed, his body shook. Wendy asked me if I could provide her with the ARVs. It was a question that people would ask me again and again as I worked on this project. They knew that drugs existed, but they didn't understand why they couldn't access them. And of course, I had no answers for them. I did feel that this question magnified the reality of the pandemic and how poverty and a lack of resources contributed to the spread of HIV. In the end, I decided to focus on the individual stories because that's how I felt that you could best understand it. I wanted my images to act as a record for those who have been lost and as a reminder to those who remain and seek treatment. It is impossible to encapsulate my entire experience covering this issue, but I believe that even a few stories, are powerful enough to remind us that each life matters. This is Florence Alfonso from Malawi. What I did is I created a multimedia piece with MediaStorm. Brian Storm generously donated his time and energy to create a 12-minute piece that included my images, audio, and video that I'd collected over the years. It was a very slow-moving project because I had to work off of grants, and I'd go maybe once every 2 years or something like that. I finally created an exhibition of this work and a catalog. It's called Bloodline, AIDS, and Family, and you can see it online at mediastorm.org. Just to make it clear, I'm not part of the book project here, but I did release a book now in April with Powerhouse. So this is Florence and Moses, her son. And I'm going to let Florence speak for herself.
My husband died 1 year ago. He died with HIV. And it's the same HIV which my husband died with. I am suffering from. I am having HIV in my body. Sometimes I think of my child. If I die, where is he going? Who is going to keep him? If I saw people walking or even chatting, I think they are laughing at me because I have got HIV in my body. Sometimes I become speechless to them, just staying in my house alone without anyone to chat with me. I think of my baby and my young sisters, that if I die, who is going to keep them?
I returned to Malawi 4 months after I interviewed Florence, and both she and her son had died. I've spliced Brian's piece up to fit the time frame that we have tonight, so you're just going to see little vignettes of this. This is Christina and her daughter Chipu. Chipu slept in this bed and watched her mother literally waste away from the virus. One of the things that I think that we're not necessarily always thinking about is the psychological effect that this has also taken, the toll that it's taken on the children left behind. And Christina's mother, who is this very strong, traditional African woman, tried to nurse Christina back to life. And of course, without ARVs, she died. This is Christina's casket being carried by her father and uncles. And during the beginning part of my project, there were approximately 2,500 people dying per week in Zimbabwe. So you would go to the cemeteries and they were digging 8 graves at a time and couldn't keep up their work fast enough. And it was the old grannies that really inherited so much of the work, not only their grandchildren, and of course, in a traditional African society, they're traditionally being taken care of by their elder children, but without them and without pensions, this breakdown of society was leaving them extremely vulnerable. This is Otelia and her son Nigel.
My name is Otelia Tascani. They told me that you are HIV positive. It came as a shock to me because that time I knew that I was going to die, and I thought that I was going to leave my kids as orphans. I told the doctor that I was positive, and he advised me to take my child for an HIV test. The results came out positive, and it pains me quite a lot when he's not feeling well, because I'm always blaming myself. Why did I have that child when I knew that I'm positive?
This is Joyce. I first met her while she was participating in a mother-to-child a transmission program that would provide mother with medicine to help prevent children from being born HIV positive. She was this beautiful, strong young woman. I photographed the birth of her child. And one of the nurses who I got to know in this program called me about a year after I had photographed her child and her together, and they were both seemed to be doing well, called me with the news that she had passed away. And it was then that I really started to understand that that without treatment, that oftentimes people just have absolutely no chance. I worked with a lot of home-based care groups, and this woman was alone, abandoned by her family, more or less, and her little boy was the only one fetching, looking after her, more or less. And again, you see just how devastating this is, not only to the parents, but to the children. This is Joyce, who was looking after her siblings while her mother was in the hospital. And her interview was really quite powerful. Something that I did after the multimedia piece, so I don't have that with me. Children who have been orphaned. This is Caroline. Andrew's aunt, who also looked after Andrew's family, mother, and after nursing her to death, then took care of Andrew. This is Joseph and Viola, and their son on the right-hand side on Viola's lap died the day after I took this photograph. And Joseph at the cemetery. This is rural Malawi in Zimbabwe. And this is really where you start to really see the effects of so many men who have been lost or either in the urban areas working. Women are at home with the children or the sick. And that those who don't get tested early enough are the ones who tend to not survive, even if they do get on ARVs, because their CD4 count is so low. I'm going to quickly, and I only have 10 minutes. This is Rose. She's somebody who was on a waiting list in Zimbabwe, and treatment didn't come soon enough for her, and she died. Maria Vindi. She was actually a nurse in South Africa and didn't get tested early enough and was broke and had to go home with her mother. She's here with one of her home-based care volunteers, Forget Matuza.
My name is Forget Gutuza. I like to work in my community. We go door to door, visiting HB patients. I'm very proud of this. I don't get paid, but I know that God will pay me one day. So I'm working for God.
That sequence was at Mashambunzo Care Trust, which was a hospice that I worked with quite a lot in Zimbabwe. I'm sorry it's cut very abruptly, but a patient with a handful of medicine. This is Malawi. This is Zimbabwe. This is Susan and her son Simba. Kudzanai. This is at Mashambunzo. There's a hospital in Malawi. This is a gentleman who was a police officer, again in Mashambunzo. hospice, a tuberculosis ward in Malawi, and one of the most common opportunistic diseases that go along with HIV is TB. Herbert with his grandmother. This is rural Malawi. This is Ledzanai and Ellen, her sister. Stella, her daughter Mary. Stella and Fred, her son. Because hospitals oftentimes cannot do anything for patients, patients are at home, they die at home. And one of the important things with Mashampanzo was that they were able to provide a clean, safe place for people to die with dignity. But in many places, especially in rural Africa, that doesn't happen. This is Mavuku. He lost his mother to AIDS. Malawi. And this is Fanizo, Malawi. Just kids being kids. And when you look at the statistics again, something I think that's also striking is the fact that, if you look at an age bracket and the likelihood of them contracting HIV, it's staggering.
Me and my wife discovered that we are HIV positive. It has been a difficult time. This thing came at a time when I didn't expect it. In my prime time when I was starting to climb up the ladder in the corporate world, it has sort of robbed me of everything, all my future. I became seriously ill. We were faced with huge medical bills. That left my wife, that time she was still teaching. She was the only one who had to fend for the family.
My name is Fortune Masarura. I've been married for the past 20 years and I'm HIV positive. As a teacher, it was very difficult discovering that you're HIV positive. It was difficult to tell any other person about the issue. So I decided, let me do something about it. I had to disclose my status to the whole school. Everybody cried, but I didn't cry. I wanted their encouragement, their support, and I wanted them to see me the way I am. I'm just trying to make sure that other people know that HIV is not the end of the world. They can actually live with HIV for a very long time.
There is need for awareness because AIDS does not know color or creed. It doesn't care whether you are educated or not. We are not talking about numbers only here, but we are talking of people. People whose contribution would make a difference in the development of the country. HIV and AIDS has decimated so many families. They have no access to treatment because there is a shortage of drugs. It's a disease that one can survive with, but there is need for medication. There is need for education. So what we need to do as people of this world is to unite so that we can fight HIV and AIDS together. I wish, and it is my hope, that one day some people will hear us and come to our aid.
Was an incredible undertaking, both by Magnum and by the Global Fund, to actually show you what these antiretroviral drugs can do. I'm going to be really quick because we want to get to a discussion and be able to take your questions as well. But I was going to show you that we did I was the former director of photography at Time magazine, and Mark Lubell came to me and told me about the project when it had first gotten underway. There had been some of the before treatment pictures had been shot, and they were talking about having a media partner to work with. So I was going to just show you the layout that we did. It was up for a moment a second ago. Does somebody know? Oh, there we go. There we go. Okay. So anyway, this is just the print version of what we were able to do, and it was a couple of photographers. It was Jim Goldberg and also the work from Haiti. And in the magazine, you're so limited by space now. In publications, it seems like increasingly there's very little publication space, print space, for still photography. So what's exciting to me about what we're looking at tonight, and I hope is part of our discussion, is that the multimedia that are being put together now and can be put on the internet can, even on time.com was great because we were able to link it to Magnum in Motion. You can create these sort of viral links all over the place. With Kristen's project, you have Brian's mediastorm.org, but then people pick it up and put those links on all these different places, and you're able to do far, far more with multimedia than you're able to do often with the limited distribution of books. You know, an average book sale for a photography book, and not even a photography book directly related to AIDS, is 4,000 to 6,000 copies. And yet you can hit 10 million people with the right sort of viral connections through media partnerships and partnerships with the drug companies, and through efforts like Magnum's efforts to bring these important projects to light. So I just wanted to say, as an editor, that I feel like what we should do is try as hard as we can to link together now, instead of having everything be so separated. With a major project like the Access to Life project, I think what's exciting is that you can partner with different companies and different media organizations and try to get this, just get it out there, as Kristen was saying. The problem is just getting the word out. So I say bravo to Magnum for this effort. And Fred, did you want to come up and say something? Oh, okay. All right, so I guess we're going to come up and do a panel discussion for you now. Thank you.
Okay, so is the mic on? Can you hear me? Yeah. So we have one panelist who wasn't a speaker, is Rosie Vanek, who's the project manager of the Access to Life for the Global Fund. And I just thought it'd be a good way to start, since you're not a photographer, you're not involved in magazines, but in fact you work for an NGO. Maybe you could tell us, what do photographic projects like this actually do to help people in the pictures?
Is this working? Well, I think actually having Kristen's work seen tonight is an excellent counterpoint, because essentially we at the Global Fund we often need to talk about the impact of the work that the projects we support, what that impact is. And by and large, the story that you have shown really, that is the story of AIDS in the developing world over the last 20 years. But what we are seeing at the Global Fund is that there really is a different story to be told, and Gilles referred to that, which is that although there are millions more people who need access to treatment, there are millions who are getting it, and that it's life-altering for those people. So I should maybe back up a second and explain that the Global Fund was founded to fight the 3 pandemics which are the greatest killers, namely AIDS, tuberculosis, and malaria. And among those 3, about 60% of the resources that we allocate to countries go toward AIDS. In the 7 years since the Global Fund was founded, that has amounted to $15 billion over that entire time period. So that's a lot of money, and the donors that provide that money need to know what is the impact of those funds. And understandably, there's a good deal of skepticism in the world of development funding as to, does the money work? So when we set out to create this project, because when we were looking for photographs to demonstrate that the money does work, what we came upon was one grainy, not very impressive set of photographs from Honduras that some of you may be familiar with, of one person who had been dramatically changed by having treatment. And we thought, this needs to be seen. People need to see the kind of impact that treatment, and I should specify, not just treatment, but free treatment is having in the countries where not just the Global Fund obviously is supporting programs, but we are the largest supporter of access to treatment in the world today, and we are supporting programs in 140 countries, I think, at this point. Mm-hmm. So that's the backdrop to the story. And really the aim of telling these stories, both through photography and through the writing and the interviewing that went along with the photography, is to convince both our supporters and the constituencies that they are meant to respond to in their own home countries that the money is well spent, and that not only in that way the project is a thank you, a recognition to taxpayers, to donors, and also to the health workers who are carrying out the work for what they're doing. And as Mark said, it's a thank you to the participants in the project who help us to tell that story.
So basically the work is being shown not in the countries where they're photographed, or you're also showing the work there? Would there be an exhibition in Rwanda of Gilles' work? Would there be a point to that?
There might be a point, but to be honest, I think in almost every country, the participants agreed on the basis that the work wouldn't be shown in their home country. And that's, I think, comes down very simply to stigma.
But it being on the web, is that a problem? Because you can get the web anywhere.
That's true, but well, I should say that in many of the places where people who participated are living, access to the web is fairly limited. But you're right. But on the whole, having an exhibit which also draws media attention and so forth, our agreement with them was to not show it in the home countries. Yeah.
So I'm just going to ask a few questions and open it to everybody. One of the questions I have always with work on human rights issues is, are you guys like witnesses in the documentary traditional sense? Are you advocates? Are you, just showing it like it is? Are you showing it with a purpose to leave out certain things and focus on certain things to get certain results? And Kristen, I know you've worked with the latest book, you've worked with the film with Madonna and so on and so forth. Where do you fit into all that? Are you an advocate, or are you a documentarian, or are you both, or?
I think that I've become both. At first, it was strictly about documenting the stories and exposing others to them, and I've evolved as a person through the connections that I've had with people, to the point that I think that because of the extreme desperation, that I've partnered with NGOs. I've always worked actually independently. I was never hired by a magazine, unfortunately, and was only able to really work on this project because of grants. So that was, for me, a very frustrating part, because I always felt like I was sludging through quick, it was hard. It was very hard. And in the end, I felt that it was, this work needed to hopefully could affect change, and that that I had, all of this work that could be used as a tool to certainly highlight the issue and raise funds, and why not partner with NGOs? So I worked with Keep a Child Alive a couple of years ago, and more recently with Raising Malawi, which is Madonna's organization, and I don't represent those organizations. I was not hired by them, but I'm very happy to have my work utilized as a tool. And and this partnership with Madonna is for me a fantastic way to broaden an audience, at least an audience that normally would not be particularly interested in AIDS because of her involvement.
But just one follow-up. If you were working for Time Magazine, for example, would you photograph differently than you did?
No, I wasn't. No. It's what was kind of interesting is with the multimedia piece, which I'm so happy that I was able to actually weave it together. The audio and the video was only done because of the fact that I'm not a writer, and I wanted to make sure that I had people's words verbatim. And it was just kind of amazing that in the end we were able to edit it together. But no, I don't think that's ever something that comes into play.
And Gilles, do you want to take the same question, the difference between advocate, witness, and so on?
Listen, I'm here to help, so I'll take the question. First thing, I really want to express my admiration for Kristen for the courage and the persistence to do this work over a long period of time and in difficult circumstances. And so I'm going to be very humble in this. After all, what I did was essentially twice a week. 2 weeks essentially. 1 week at the beginning of the treatment and 1 week at the end. And to answer Fred's question, I didn't do it as an advocate. I did it to be of service, and to be of service to the notion that that through the project of the Global Fund, we could make a difference, and that drugs did make a difference. So in a paradox, and this is maybe what you're here for, Fred, you're going to have to disentangle that one. I was not an advocate, I was a documentarian, but to the reverse of you, in a certain way, I did change the way I was photographing. Which is that because I was of service, I tried to photograph in a very, very simple and transparent way, so that to have as little effect as possible in the photography. But it was as much out of respect or attention to the patients as it was out of trying to push, what documentary expression can be about, and being very wary of my own quirks as a photographer.
Mm-hmm. Okay, so let me try then. Mark, you had 8 photographers working. Assume that Kristen is the 9th photographer. Her work seemed very, very different to me than the other 8 people's work that you showed. And what's your sense, what you were trying to do? What is she doing different? Is it the same kind of photography, just to keep going with this idea?
Can I answer for you?
Go ahead.
This is the person who hates words.
It's like...
I'll follow up.
No, Fred, I think that you're doing a disservice to the project that Magnum is undertook. because when I was in Washington at the Cochrane and the show was hung, I was actually amazed by the difference between each of the photographers and by the difference in their attempts, both in the image making and how they wanted to hang their pieces and so on. So, Kristen, you would be a welcome addition to this diversity.
Okay, so Mark, do you want to follow up?
Well, I was going to say very much the same. In fact, from the very onset of this project was to look at different photographers in their approach and to see how they will engage in the subject matter and to come back with work that will be very different and will show the complexity and will show the different topographies of each country to show that this is a global issue, and each photographer that's going to engage in this is going to engage in it in a different way and is going to show it in a different way. And when you have an exhibition, you want to show those differences and make an exhibit that is quite interesting for people to look at. I have to say that the integrity of Magnum as an agency is that we're not work for hire. You know, we don't just go off there and do something and come back and unless it's an advertising job or something like that. But it's very important that when we do a project with that in mind. And what I really enjoyed the conversations initially with Global Fund is if you look at their business practice, how they actually invest money in a country, they basically go to a country and they say, okay, you have an issue. Here's X amount of millions of dollars. We'll see you in 2 years. And in 2 years, we want to see 30% decreases in this, and this. And we're not going to tell you how you're going to spend that money. We want to come back in 2 years and measure, because we don't want to dictate to you, because we don't know the cultural differences. It's not a box of a formula to fix some of these problems. We're going to put the onus on that country. Mm-hmm. Very much the same way they came, and we had these conversations with Magnum, that they basically, sorry.
It's not mine.
Very much the way they came to Magnum, and they had such confidence in the medication that they were pretty confident about the results of the medication. And really what they wanted Magnum to do was tell the story. Magnum had final cut in the photography, and in the multimedia. So they allowed what they are actually doing and with the work to speak for itself. And I think that gave Magnum and gave the photographers a tremendous amount of confidence from the integrity standpoint.
Okay. So just one more question from me, and then we'll open it up. Mary Anne, having worked at Time Magazine for a number of years and so on, is it your sense that this kind of coverage of important social issues is going more and more to the NGOs, or that they're the ones sponsoring it, and the magazines are doing less and less, at least less and less, that's in depth? What's your take on that?
Yes, absolutely. I think the field is really searching right now. The field of photojournalism is really searching right now for the new model. I think that photojournalism is in a state of incredible transition, largely because of the easy distribution and wide bandwidth of internet distribution of photography. And the question is how you retain the sort of quality of work, and it doesn't become that photojournalism as a profession, or documentary photography as a profession, still has a place that's not only on the internet but also in print. I think that all magazines, not just Time Magazine or the news weeklies, have been suffering from the same economic problems that are affecting the whole world right now with the global downturn. Mm-hmm. But I think also what you're seeing is that there's this ready accessibility now of in-depth, long-term projects through, as Kristen said, with her work that went over 7, 8 years, 9 years of work, have been supported through grants either from foundations or NGOs. When you said NGOs, NGOs are a large part because NGOs have always been facilitators for documentary photographers working on the ground, but now they're actually supporting the documentary photographers to do this kind of work. And this enables the magazines or different publications to not have their investment be, so huge at the beginning for so little of what they can publish, but they can be media partners with the NGOs or large projects like Access to Life. When Mark brought it to time, there was no question. They said, basically, we want to give it to you. We just want to put it out there. And it was interesting because that was the first time, at least in my experience, where anybody came and said, here, here's a silver platter of amazingly beautiful stuff that's been supported. And so then as a magazine, you all you have to do is give up pages to publish it. And I think that's happening increasingly in the industry.
And originally you promised me the entire magazine. I remember that.
Like I could do that.
Okay, so given the time, why don't we open it to any comments or questions that people in the audience have? There's a microphone, I believe, over there. And does anybody have anything to assert? If you don't, we'll just keep talking, but there's one over here.
What makes a project like this sustainable for Magnum? Where does the money come from, essentially, to go shoot these projects? Are you ever going to get that money back, or is it from the NGOs? I was just curious about that.
It's supported from the NGO.
I mean, this specific project was supported by the Global Fund. But that said, Magnum Photos over the years have done very much what Kristen has done very, very courageously, which is they've maxed out their credit cards, they've applied for grants, and with bits and pieces, I've managed to produce work that had some meaning. So there's not one way to do it.
Okay, anybody else? Did you on there?
Yeah, Kristen and Gilles explained a bit about his process, his attitude toward taking pictures. I was wondering, how did you progress from story to story? What do you think about? What happens at night after you've done a day of pictures?
There's certainly a lot to think about. It was a slow process for me. In the beginning, it was self-initiated and self-financed. Just essentially started, as Gilles was saying, a lot of photographers, unfortunately, because of the lack of support, both from a publication side and a foundation side, if you feel passionate about a story or something, you basically initiate it yourself, and that's how it began for me. And then slowly over time, I was able to get a few grants that allowed me to go back. And so, in the last couple of years, I've actually been working on the post side of things with the book, with the multimedia piece, and actually an exhibition, a touring exhibition, which is a whole other set of issues and an experience for me, just organizing it, trying to expose it, get it out there. I think that I've also gone through different phases as in the beginning, ARVs were not available. They slowly became available, and now many of the countries in the sub-Saharan region have a program set up to provide free ARVs to people, or ARVs at a very at a subsidized amount, and seeing the transformative effects of medicine has certainly changed my way of looking at it. In the beginning, it was incredibly, incredibly depressing. As I say, the death rate was just astronomical. That in many places, those rates have slowed down, and there is a sense of hope now. So I think that for me, that would have been the overall feeling now. For me, I feel as though I'm finished with this project, or I'd like to move on from it, that there's a book, there's this exhibition, the multimedia piece, I'm able to, expose it to others. And
Did you shoot exclusively in black and white?
I did, purely because of financial reasons. I processed my film myself, and so it was something that I didn't have the sponsorship to shoot color. But later, as I took up digital photography and was able to shoot digitally, I started to shoot some in color. And then when I was hired by Madonna to participate in her documentary, I Am Because We Are, I was able to shoot some color for that. So.
Just, Rosie, do you have a statistic on the percentage of people who need ARVs in, let's say, sub-Saharan Africa who get them for free?
I have to say that maybe because I wasn't aware I was going to be on this panel, I didn't pull together my statistics, so I don't have that at the ready. But well, maybe it's useful to say that in some countries, I mean, Rwanda is an excellent example, although, as you said earlier, Kristen, there's still tremendous need. There are countries where the national programs are really closing in on the target of universal access for treatment, which is where anyone who is infected with HIV and is reaching the threshold that that country considers a standard at which they should be in treatment, they have it, and it's available to them for the rest of their life, and the country's committing to that. So I think I like to cite Rwanda because it's a country with such a backdrop of difficulties and a history of civil war, and yet, nonetheless, they're one of the real shining stars in terms of making treatment available to their population.
May I answer to your question as well? Because I understood your question in a slightly different way, and I apologize if I misunderstood. I mean, I understood your question as what were we thinking about, at the end of the day, after spending time with those... What the experience is. Yeah. Well, you saw it in the text, the narratives of those patients. So much pain and so much difficulty. And the fact that if you're alone, like Olive, you really are in deep trouble. But if you are like Marceline, who has a brother who's wonderful, who is his sister's keeper, you have a chance. And how important it is to have a family around you. And then the other issue which is underlying all this, and which Kristen mentioned, which is in the upstream of, or in the before of the appearance, the appearance of AIDS on the landscape, which is the economic. The importance of the economic on Africa and on the emergence of AIDS and the explosion of AIDS in Africa. But also when it comes to some of the patients, the importance of the economic. At one point, Marceline felt well enough that she could go back to the market and sell a few things. So I did spreadsheets with all the patients to understand their budgets, to understand, what money was and how they lived. So for Marceline to be able to go back to the market and sell a few onions, her brother Jean-Marie had to bicycle to the border of Tanzania. So that's a whole day for him, and come back. And then she would spend the day at the market. So essentially, the two of them worked 2 days for $14 or something like that. And when you know the importance of nutrition, of having a good diet, of having a roof, and on the outcome of the cure, because it's not only that you have to take the drugs, is that you have to eat. Those things weighed on, on me, the importance of the economic and the historical importance of the economic in Africa.
Okay. Are there any other questions or thoughts? Yeah.
I was actually wondering if Rosie or someone can speak about some of the other issues in the other countries that were very specific as to how AIDS was spread. I think Mark Lubell mentioned something about culture of lethal drugs in the other countries and sort of things you can expand on that.
Sure. The Global Fund, when we were deciding how to structure the project, we actually looked for 9 countries that spanned all the regions where AIDS is a, they're heavily burdened countries. And we also wanted to show, as your the differences that you're referring to, which is that AIDS is really, it's a different story in each different context, and it's transmitted. I wouldn't say it's unique, but to be specific, for example, in the context of Russia or Vietnam, intravenous drug use is the primary mode of transmission. And typically in Russia, what Alex's work reflected is that people who are drug users who are infected, it's kind of a multi-pronged problem for them, because often they're in very, very poor health. They have poor family support, as you're referring to, Gilles. They're often very late to come for treatment. In fact, what we heard from the medical staff in St. Petersburg, where that project was shot, was that the treatment is there, the facilities are there, the support is there, they're ready to provide it to those who need it. The problem is that those who are infected they don't come for treatment, or when they do come, it's far too late. And I think, as Mark mentioned in his presentation, what those subjects of photography died of was in fact not AIDS-related causes. It was cancer, it was alcoholism, it was the other health issues that they had, that their bodies, even though their CD4 counts were improving, their bodies simply succumbed to the other health problems that they had. In sub-Saharan Africa, it's most often through multiple partners, through sexual transmission. By contrast, in Peru, what we saw was that there's a cultural acceptance of men who have sex with men, which is the term that they use is heteroflexible. So it's not. I mean, I think there would be far less acceptance of being considered gay, but so as you may have seen, the work that Eli returned from Peru with reflects that the transmission rate there is very high among transvestites who are commercial sex workers, whose clients are those heteroflexibles, so to speak. So in that context, AIDS is, those who are most vulnerable to AIDS are those who are marginalized from the health system because they are considered barely acceptable. Society tolerates them, but they're not. Most often, they're not offered the same kind of health system and outreach that others would be. That would provide prevention efforts to those people, which makes them most vulnerable. Trying to think what piece of the spectrum I might be leaving out. Perhaps Mali, where husbands having multiple wives impacts AIDS transmission, and obviously the stigma associated with using condoms within a marriage, which is pretty much unheard of as far as as far as we know. India, I would say one of the factors that really impacts transmission there is the fact that men, and this is true of many countries, but that men very often are away from home for very long periods during the year and have other sexual partners in urban centers, for example, where they might go to work, then return home, again, using a condom within the context of a marriage is unheard of, and therefore wives are infected and it's passed on to children and so forth.
Have you done similar projects on tuberculosis or malaria, the other diseases you deal with?
No, this was a first for us. And we would like to continue to do work like this about other projects because it's, as we thought, it's an extremely effective tool to have a book like this and an exhibit and so forth, but we have yet to do so.
Yep, Joe?
I wanted to ask you, where do you guys get your money now? What countries do you deal with? Joseph Rodriguez.
We're funded by, I think it's now about 45 donor countries, and most of them are in our Western developed world countries. We're also supported by the Gates Foundation and a few other private sector entities. We receive money from Product Red partners. I don't know if you all know about Product Red, which is the Gap and Armani and a few other partners that are part of Product Red at this stage. But
The U.S., how are we balanced when we talk about the countries? When we talk about Western countries, you're probably talking mostly about what, Europe?
Europe and the U.S. The U.S. has always been the largest contributor to the Global Fund. And that also, the U.S. contribution is leveraged against the contributions of other donors, which is to say that the funds provided by the United States are basically, they require that other donor countries match match the U.S. contribution in a ratio of 2/3 to 1/3. So there's kind of a leveraging effect that has. But the U.S. has always been the largest donor, followed, I think, at this point by France and Germany and Spain.
And one last question, with the economic crisis we're all in, is that affecting your future funding? Are you guys funded for the next 5 years, or do you every year, or like us? Photographers have to go out and get grants. Do you have to do that too?
We do, and we are we're getting that question a lot these days. I would say that we have what we call a replenishment process in place, whereby every 2 years we go to our donors and we report back to them on how how the funds are doing, where our successes are, where the weaknesses are, and so forth. So far, the sense that we're getting is that, well, first of all, I can say that no donor country is indicating that they're going to default on their pledge, and the pledges at this point are made through 2010, or in some cases beyond. Some countries pledge on a 5-year basis, and others on a 2-year basis, and so forth. That's according to their fiscal calendars. But
anybody else? Okay, Gilles, then, you talk about yourself as being of service in this project, that you're doing something to be helpful, to reach certain goals. So, and you talked about this as one of the few projects with a positive outcome versus, when you're in Rwanda before and so on and so forth. So is your sense that is this a much more going back to the question before, is this a much more satisfying way of working for you, or just another way of working for you?
I thought you knew me. It's another way of working for me. And it's a very interesting way because it allows me to look at reality through a slightly different angle, ask myself, different kinds of questions, and learn in the process.
Okay. Got it. And Kristen, do you have plans to continue working on this project, or are you now finished and going on to other things, or where do you stand?
It really just depends on funding. I think I've exhausted my energy, to be honest with you. I think I've done as much as I can do, and now I'm hoping that the work will exist as a document to, as I said before, to almost it's a history of those that I've met that unfortunately have passed away, and it's a record for those who still need treatment and that are living with the virus.
And do your pictures go back to the communities? We've seen pictures that come out, for the West, but do your pictures go back? Are they useful for families to remember people, to establish identities?
Yeah. On a couple of occasions, I have brought images back to people and to those who have helped me all along the way, like Ottilia Toscani. She's been with me really from the beginning. I've found that that they're I'm photographing very delicate, very difficult moments, and so upon seeing those images, it's very painful, and so after returning with them and showing them to some of the people that I documented, one in particular in Old Mavuku in Zimbabwe. It was just basically a portrait of a young boy, and I brought it back to this community because I was, these were very benign, easy pictures, and he had passed away, and his sister was very, very, very upset. It's not common traditionally for people to have the photographic history often. Just from a financial standpoint, people don't use photography in the same way that we do. And it really affected me in seeing her reaction, and I just, from then on, I have not done that. I've not utilized it in that way.
Mm-hmm. Okay, go ahead.
Do any of you develop and scan in the field, or do you wait till you come back?
Wait till you come back.
He's still scanning, actually, now.
No, Rebecca, who's sitting there, did all the scanning. No, it's... But it's up to the point now where, film itself, even black and white, is becoming too expensive a process.
So, Mark, do you just want to let people know if they want to go to see the multimedia pieces and so on, where they would go?
Somebody else over there.
Oh, sorry, before that. Go ahead.
I just want to make a comment. I want to say thank you very much for your work. Thank you very much for opening up my eyes to what's going on in other parts of the world. Because, here in America, we got all these, meteors, and you don't learn anything. You're not shown anything. You're not given anything. You got everything but Madonna, but you don't hear about anything else. So it's nice to hear about results of the medications that are being given to certain parts of the world, and it's promising that people are now living from it after hearing years and years of how people have died and how much Africa suffered from the effects of AIDS. So again, I commend the photographers and the organizations, and thank you very much for bringing information to us. Thank you so much.
I just want to respond to say that, right back at you. I mean, this is partly a result of U.S. taxpayers in a very big way, in the sense that the U.S. has always been the greatest supporter of the Global Fund. So that's part of our message too.
I mean, the only reason I'm here because I'm a photographer. And I travel the world also, but...
And a taxpayer also.
Yeah.
So, I mean, with all the publications that come to my house on a monthly basis and all the cable TV, I got over 100 channels, and I don't see anything. I don't know anything. I have to come here tonight to learn something. And I travel the world. It's crazy.
I did try to get this project on American Idol, but they went with malaria instead, actually. But I would like to thank you, and I'd like to thank the entire audience for coming out, because unfortunately we couldn't get Madonna to come up here. But it is great to see people come out and listen to projects like this. I'd like to thank the New School for sure for supporting this, and I'd very much like to thank Aperture for putting out a book like this, which is not going to sell, 50,000 copies, but it's important work, and Aperture does important work, and I thank them very much for their support.
So, Kristen, your work can be seen on MediaStorm if people want to go to mediastorm.org. And the Access to Life work can be seen?
At Magnum.
It can be seen at Magnum Photos, www.magnumphotos.com, on the Magnum Emotion section, or accesstolife.org. And you can see all of the entire, there's a full independent site that talks about the entire project.
Okay.
Did I get that right?
And does anybody on the panel have some concluding comments that you want to comment? Or we're
all done here.
Have we said it all?
Yeah.
Well, thanks to everybody for coming.
Thanks so much, everybody, for joining us.